Urinary tract infections are one of the more problematic but often mistreated infections. Let us see about UTIs in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a new video is released explaining a common health topic. If you want to see such videos, subscribe to this channel. Also press the bell icon adjacent to it to get instant notifications whenever new videos are released. This week's video is going to be on urinary tract infections. Urinary tract infections, except in infancy, are more common in women. Urinary tract infections are infections affecting the urinary tract right from the urethra till the kidneys. Whenever the infection is involving the lower urinary tract, that is the bladder or the urethra, they are termed lower UTIs, which are significantly less harmful. When they affect the ureters, that is the tubes connecting the kidneys to the bladders or the kidneys themselves, they are called upper UTIs, which are inherently more dangerous. What are the symptoms of urinary tract infections? All of us would have experienced dysuria, that is painful, burning urination. That is the most common symptom in any urinary tract infection. You can also have frequency, that is more times you tend to void urine. There is an urgency. Once there is a need to pass urine, you can't hold it, there is an urgency to pass urine. You can have urinary incontinence. That is, you are not able to voluntarily control urine, there is leaking of urine. You may have lower abdominal pain, you may have cloudy or foul smelling urine, sometimes it can be bloody urine. You may have fever, especially high grade fever, often with chills and rigors. You may also have vomiting. All these are potential signs or symptoms of urinary tract infection. Most important thing to understand is, in infancy, that is under 1 year of age, urinary tract infections are almost common in both sexes. That is, males may also be equally affected as the females. But once beyond that age, that is beyond infancy, urinary tract infections are more common in women. That is up to a time of 14 times. UTIs are 14 times more common in women than in men. Why is it so? Inherently, female anatomy is more prone to get infections, because their urethra is smaller, shorter, can be as short as 4 centimeters, whereas in males it is 15 to 25. So the bacteria can get easily access to the urinary tract in females than in men. Secondly, because the urinary tract is closely related to the birth canal as well as to the gastrointestinal tract, that is anus and rectum in women, the chance of getting infections is more. Why do we worry about urinary tract infections? Urinary tract infections, especially the upper urinary tract infections, if not treated properly or treated late, they can give rise to not only problems related to the kidney, like a renal failure or a hypertension in later life, but also infertility, especially in females, because the infections may involve the adjacent structures like fallopian tubes or uterus, which may lead to infertility in adult life. What are the risk factors for urinary tract infection? In infancy, the risk factors are abnormalities of the urinary tract, which can be present in children, which can lead to urinary tract infection. Hence, any urinary tract infection in infancy, you have to look for abnormalities of urinary tract by doing further investigations like ultrasonogram or other scans as suggested by your doctor. Beyond infancy, what are the risk factors for getting urinary tract infection? As I said, female sex itself is a risk factor. Incomplete emptying of urine, that is, if you tend to hold urine, this urine, because of stagnation, can get infected by the residual bacteria, so you can get more often urinary tract infection. So, holding of urine beyond a certain limit and incomplete emptying can lead to urinary tract infection. That is the reason why in pregnancy, because of the pressure effect of the uterus, your bladder can hold urine even after voiding. This can give rise to increased number of urinary tract infections. In older ages, diabetes can be a risk factor for urinary tract infection both in men and women. In women, menopause can be an independent risk factor for UTIs. So all these are potential risk factors for urinary tract infection. Constipation is a risk factor for urinary tract infection. So if you are constipated, the rectum is full, it is impinging on the urinary bladder. Because of this, the bladder cannot empty fully. Hence, there is a risk for stagnation and getting a UTI. How do doctors diagnose urinary tract infection? The symptoms are classical, but when compared to other diseases, urinary tract infection requires investigation to confirm it and to treat it. Why is it so? Because the treatment of urinary tract infection and the duration of it is determined by which organism has infected the urine. To know this, you need to do a urine culture. Even one dose of antibiotic can make it difficult to get a urine culture and sensitivity pattern. Hence, the urine culture and sensitivity, this testing should be done before starting any medicines. In UTIs, it is often essential to do investigation before starting of treatment. The investigation usually done is a urine examination along with the urine culture and sensitivity pattern. The urine given for such testing should be collected in a sterile manner and should be transported to the lab immediately. Based on the culture and sensitivity pattern, you may be given antibiotics for duration as long as 10 to 14 days. In case of upper urinary tract infection, if it involves kidneys, you might be advised admission and be given intravenous, that is through the veins, antibiotics. How to prevent urinary tract infections? Personal hygiene is a must, but frequent washing of perineal areas, especially with harsh cleansing agents in women, can itself give rise to urinary tract infection. So mild use of simple soaps or water itself should be good. In females, especially in children, whenever they are washed for soiling, that is after stools, they should be washed in a front to back manner so that the stool organisms are not contaminating the urinary tract. Regular emptying must be promoted, so withholding or holding of urine must be strictly advised against. Constipation should be avoided. What is the use of this cranberry juice or blueberry juice? These can improve the urinary flow, and some of the studies state that they might inhibit colonization of the urinary bladder with organisms. Whenever there is dysuria, they might help in relieving it and they might improve urinary flow. But they are not the definite treatment for urinary tract infection. If the infection has already set in, you need to essentially consult the doctor and be given the course of antibiotics. In males, often circumcision may be helpful in reducing the incidence of urinary tract infection. When should you get worried? What are the danger signs in urinary tract infection? If there are signs of an upper urinary tract infection, like high-grade fever with chills and rigors not responding to usual measures, if the doctor suspects involvement of the ureter or the kidneys, if there are recurrent urinary tract infections, that is more than 3 infections in 1 year, if urinary tract infection happens during infancy, all these can be potential danger signs. If these danger signs are present, your doctor may advise you further tests, including ultrasonogram and other special scans to detect any urinary tract abnormality if present. Today we have seen about urinary tract infections. The essential take-home message is don't ignore any dysuria or strangury. Kindly immediately visit a doctor. If needed, do the test and get rid of the urinary tract infection by taking the appropriate antibiotic in an appropriate course. Don't stop the antibiotics midway. If you like this video, kindly share it among your friends and relatives. To see such videos, subscribe to this channel. Till we meet again, bye.